You cannot have a summit about Greenville without talking about health care because it is such a huge driving force of our economy. And so for the next hour, we're going to be talking about health care in Greenville and the fact that Greenville, North Carolina is now a national leader in health care. And we're so fortunate to have a very expert a panel here. We have a very distinguished guest of gentlemen here who are going to talk about that for the next hour. To my far right, Dr. David Herman, who is the Chief Executive Officer for Vidant Health Systems, the entire health systems, which I believe now, Dave, is 9 hospitals. Is that correct?
It's 9 hospitals with 13,000 great people taking care of Eastern North Carolina.
Yeah, and Dr. Herman is, I believe, in his second year.
Third year in Greenville,
and came to Greenville from
the Mayo Clinic in Rochester,
from
Minnesota.
the Mayo Clinic. So we're very happy to have you here.
Great to
to
be
my
here.
immediate right is my friend Dr. Paul Cunningham, who is the Dean of the Brody School of Medicine at ECU. And Paul, it's great to have you here.
Thank you very much, Henry. It's great to be here. I'm the 15th of the Brody School of Medicine, and this is my 6th year coming up.
Great to have you here. To my immediate left is my friend, Dr. Greg Murphy, who is a private practice urologist here in Greenville and was just elected to be the Chief of Staff for Vidant Medical Center. Greg, thank you for being here.
Thank you, Henry. Happy to be here. Been here for 20 years, and I'm happy to work as the lead physician to represent our needs and physicians' concerns to our community administration.
Looking forward to your comments. And to his immediate left is the president of Vidant Medical Center, our great hospital here in Greenville now, Steve Lawler. Steve, thank you for being here.
Well, thank you. I think this is a great forum and looking forward to the discussion.
All right, let's start with Dave Herman. What I'd like to do is give you all 3-4 minutes to talk about the state of health care as it relates to our community and what you see as the challenges and the benefits. And we'll start with the Chief Executive Officer for the Vidant Health Systems, Dr. David Herman.
Thanks very much, Henry. We were just having a conversation offline before the program started about when we graduated from medical school. And I woke up in May and recognized that I had graduated from medical school 30 years ago. And looking back 30 years, so much has changed, Henry. 30 years ago, it was what could we do for patients, and now it's really questions of affordability. So when we take a look back, you can't spend any time listening to the radio, watching TV, reading the newspaper, without recognizing that healthcare has really taken the headlines, not just in Greenville, but across the country. And the biggest issue right now, Henry, is affordability. There is so much that we can do, and there's so many things that we can help people with once they become ill that the amount that we could spend would be endless. When we look at what we're spending in the United States on health care right now, it's about $8,100 for every man, woman, and child in the United States on an annual basis. And I know when there's been a lot in the newspaper regarding, well, why are people's health care premiums so high, Henry? People are complaining about $250 a month health care premiums. If we take that $8,100, that's $675 a month for every man, woman, and child in the United States. And I think we're coming to the realization now that if Americans continue to become ill at the rates that they are, there will never be enough money to take care of all of us the way we can be taken care of by the current healthcare system. 18 cents out of every dollar that's spent in the United States is spent for healthcare. That's really good for us here in Greenville, because when we look just at Vidant Health, we have about a $2.2 billion economic impact for Eastern North Carolina. And a lot of that money, because over 70% of the patients that we serve are paid for by the government, either Medicare or Medicaid, and most of that money comes from the federal government, that's a lot of money that's brought into this community that supports the 13,000 jobs, a lot of things that happen in the community. But the question becomes now, Henry, whether this is sustainable or not. For a long time in America, we've regarded the provision of health care services as a proxy for providing health to the population of the United States. And now we're seeing that that equation might not be equal. Paying all that money for health care might not be creating the levels of health that we need. And so that's a cause for a lot of the conversation, a lot of the discussion. A lot of the governmental impact we're seeing on healthcare right now is because it's just become such a large part of the economy and become so expensive. and many of us feel that we're not getting what we want out of that system. So at Vidant Health, we're working very, very hard to design that new system of care, not just to take care of patients when they're ill, but what can we do in partnership with the community, in partnership with private practice physicians like Greg, in partnership with the Brody School of Medicine and Paul and his colleagues, to deliver better levels of health to Eastern North Carolina so we don't have to make the investment in taking care of people once they're sick. Across Vidant Health, we have almost 1,500 hospital beds, and Steve's medical center, Vidant Medical Center, was 90% full this morning. There is no one in that hospital today that wants to be there. And so what are we doing as healthcare, as leaders of our community, to engage the community in the conversation that helps us to all stay healthy, rather than asking healthcare to intervene once we become ill? So those are the conversations that we think we need to have, and we're looking forward to having the conversation, some of that conversation, with the community this afternoon.
Thank you very much, Dr. David Herman. Let me turn now to my friend, Dr. Paul Cunningham, who is the Dean of the East Carolina University Brody School of Medicine. And I believe it was in the mid-'70s that Dr. Leo Jenkins had the dream of East Carolina having a medical school. And I know you were here, you left, you came back, and now you're the Dean, and we're lucky to have you here, Dr. Paul Cunningham.
Thank you, Henry. And I'm going to try and pick up where Dave left off. And Leo Jenkins was invigorated by a doctor in Plymouth, North Carolina, Dr. Ferguson, who told him that the citizens of Eastern North Carolina were having a desperate time in achieving care. Access to care was the issue then. Of course, we knew that the health care characteristics of Eastern North Carolina are devastating and remain that way today, but were even worse 40 years ago. And Dr. Ferguson then persuaded Dr. Jenkins that East Carolina University needed a medical school. And he started a campaign which lasted over a decade. East Carolina University the East Carolina University Medical School started in 1973. And we have built to the point where we graduate 80 students per year. Almost all of them, the vast majority of them, settle in North Carolina. All of our admissions to the Brody School of Medicine are residents of North Carolina, and the vast majority of them stay in North Carolina. In fact, if a student graduates the Brody School of Medicine and goes through a residency at the affiliated hospital, Vidant Medical Center, 75% of these physicians will practice in North Carolina. 27% of the family doctors in North Carolina are graduates of the Brody School of Medicine, and that number is increasing. So what am I talking about? There is the economics of medicine. We really need to figure out how to pay for this and to make our systems more efficient. And with Vidant throughout our region working on that end of the efficiency, it's critical, it's at the highest priority for the Brody School of Medicine to supply at least a component of the human power, the resources at the provider level, at the physician level, that will offer the best access to the citizens of the region. All 1.5 million citizens of Eastern North Carolina need to be able to find any service that is applicable to their needs within a reasonable distance. I would say 20 minutes of wherever they live. I think it is just a reasonable requirement. And part of our mission then is to help to provide those physicians. One thing I must remind us all about is that we're not alone on our health sciences campus. The Brody School of Medicine is affiliated with the most prolific school of nursing, the most remarkable school of allied health, and of course a brand new dental school that has the same mission of the Brody School of Medicine, and that is to populate Eastern North Carolina, in fact North Carolina as a whole, with physicians who are prepared to serve the citizens. So I think I'll leave it at that for the moment, and back to you, Henry.
Okay, thank you, Dr. Cunningham. And when you hear you talk about what's going on inside the School of Medicine, you almost have to pinch yourself if you came here in the 70s when I did, or you grew up here, and realize what an incredible collaboration we have, not only with our hospitals at Vidant, but also with the Brody School of Medicine. We're so fortunate. and that's why we're talking about it today. Let's go to Dr. Greg Murphy now. Dr. Murphy was elected by the physicians to be the physician representative for Vidant Medical Center. And Greg, you probably bring a little different perspective from the private practice point of view on the medical community here.
I do. Thank you, Henry. And I'll echo Dr. Herman's and Dr. Cunningham's comments. I do bring a little different perspective. I've been here for 20 years. I have been a practicing physician for 20 years here, and I feel now, personally and also collectively, that these are the most challenging times in medicine that we as physicians have ever faced. We are forced to deal with access to care. We're forced to deal with financial viability. We have problems that are not going to be easily solved and problems of which we've never faced. The ACA, we're finding out, really hasn't signed up the people that we thought were going to be signed up. We're seeing folks that, especially at the beginning of the year, have these massively high deductibles that therefore put off seeing physicians. There's a high rate of bankruptcy now due to medical expenses. And I see this on a granular level. I see it on a daily level of people that show up and I personally take care of, my colleagues take care of. This issue and these issues really have not faced us on this level before. All America desires to be cared for. We have wants and needs far greater than anywhere else in the world. And tempering that to try to find not only what we can do, but what we should do is one of the big balances that we're trying to deal with these days. It's a private world. Our nation thinks in private terms that everything should be done, and I think a balance is going to have to be met as to what we can afford and what should be done. So, with that, I'll turn it over to.
Okay, let's go to. Thank you, Dr. Murphy. Let's go to Steve Lawler, who is the president of Vidant Medical Center here in Greenville. And it's great to have you, Steve. Steve, what are your thoughts?
Well, it's great to be here, and it was fun to listen to both Dr. Herman and Dr. Cunningham and Dr. Murphy talk about how long they've been here, because we do have a community that's really decided to make Greenville and this region their home, and I'm proud to say that I've spent a lifetime here. As Dr. Murphy said, it really is an extraordinarily challenging time in healthcare, but I would also say it's an incredibly exciting time in healthcare. And I think the rate of change and challenges and innovation that has to take place over the next several years really is unprecedented. And I do believe that we have the right complement and the right talent of folks here in Greenville, North Carolina, to address those challenges and be successful. And I think it's easy to really get caught up on the things that the people don't like about healthcare, the Affordable Care Act, or the fact that healthcare is extraordinarily expensive, or sometimes healthcare is extraordinarily difficult to navigate for patients and families. And all of those things are true. But I do think we have an example of what's right in healthcare, here in Greenville. And this community is extraordinarily fortunate to have in North Carolina the probably most successful public-private partnership in the state, which is a 40-plus year marriage between the Brody School of Medicine and Vidant Medical Center that's trained thousands of physicians for North Carolina. I think we've got a superb medical staff that works extraordinarily well together, so we're not divided by some of the competition that happens in other markets. Our physicians and hospital are really focused on working together for the betterment of patients. And I do think that when we talk about the economy and the economic impact of the footprint here in Greenville, it is pretty significant. Dr. Herman mentioned about $2.5 billion in the region. When you include ECU Brody School of Medicine and the private practice, it's about a $3 billion impact to eastern North Carolina. And that's why it's so important, one, to make sure that we're focusing on those things, as Dr. Herman said, value, best quality, best experience, most affordable, but we're also working with our elected officials to craft thoughtful policy that helps to protect that valuable resource that we have here. And that's one of the exciting aspects of healthcare. Many people don't think that healthcare sometimes is involved in crafting and being involved in public policy, but it's essential that that we're in the tent, and in many cases taking the lead, because the people that you want to design healthcare are actually the people who have to deliver it. And so we're working with our friends locally as well as Raleigh and at the national level to be much more engaged and to have a voice so that we can represent the people that we're privileged to serve.
Let me let's start the discussion. Steve, let's stick with you. There's so many issues here that I want to get to, and I want to make sure that people in the audience have a chance to ask. The medical community, along with our university, is the economic driver in this town and in this community. And how many employees at Vidant Medical?
So at Vidant Medical Center, we have about 6,500 employees. And just to scale it, it takes about $1 billion a year to run Vidant Medical Center, which is larger than the budget for the city of Raleigh. And, you know, our hospital is the busiest hospital in the state, and it's in fact one of the busiest teaching hospitals in the country.
You know, I don't want to scare anybody, but, you know, we keep hearing about the Affordable Care Act. We just witnessed here in Pitt County substitute teachers being laid off because of some of the new regulations with the ACA. What's the status as we move forward of our workforce as it relates to Vidant and what the community can expect?
That's a good question. So I think we are maniacally focused on making sure that our patients and our families receive the best care. And we're designing systems and processes and aligning people to ensure that that takes place. You know, our medical center really is slightly an anomaly in regards to the field, where many medical centers are seeing significant decreases in admissions. As Dr. Herman said, we started out today at 90% full, and many of our acute care beds were completely full. So I think by, you know, building our reputation as a destination and a center for excellence, by recruiting and retaining the most talented physicians and staff, it positions ourselves to be successful and to be the first choice. And it's kind of like shopping local. And when people make a decision in Eastern North Carolina for healthcare, we want them to stay in Eastern North Carolina. And, you know, there are significant challenges with the ACA. We know in the next 10 years, cumulatively, we'll be paid about $400 million less from CMS, from the federal government, than what we're paid today. And that's why we're doing the hard work now, redesigning systems, working with our physicians to choose, you know, those products and services that are most economical and provide the best outcomes for our patients, and really redesigning how we interact and stay connected with our patients, not only in the hospital, but also outside the hospital. And I think that connection outside the four walls of our medical center will be extraordinarily important. And I do think from a workforce perspective, over the next 10 years, people who would traditionally think of themselves as having an experience in a hospital as a worker may transition to having an experience in an incredibly rewarding career in a different area that's still connected to a system of care.
Let me go, while we're talking about this, let me go back to Dr. Herman. Dr. Herman, the Affordable Care Act, we keep hearing about the problems with the cost of medicine, insurance, the cost of medical care, and that essentially was the reason why we had this big change in the National Health Care Program. It would seem to mean then that there's going to be less money coming into the medical system. And so I just have to ask you, is that a bad thing for Eastern North Carolina and Greenville?
I think it depends a lot, as Steve said, on how we respond to that change. We know that we can do better with the care that we deliver. I think I said in my opening remarks, if people continue to get ill at the rate they're getting ill, there isn't enough money, even if we continue to raise the amount of money that we spend every year. So our challenge at Vidant Health, the challenge at the Brody School of Medicine, the challenge that Dr. Murphy has with his patients is how do we keep them well? So we have adopted a healthcare system that worked very well for us in 1980 that doesn't work very well for us right now. When Greg and I were interns, we admitted people for colonoscopy. You stayed overnight for colonoscopy. It's practically a drive-through procedure right now, Henry. I mean, you're there and you touch and go. It doesn't take very long. When I started treating diabetic patients in 1980, if you had type 2 diabetes, maturity onset diabetes, your lifespan was expected in 3 to 5 years. Now we've made that a chronic disease. So we have an acute care model that we're trying to employ right now that doesn't work very well for chronic disease. We talked about all the money we spend, Henry. 5% of the people in the United States spend 50% of the healthcare dollars. And those are the people like me who are over age 55 and that have 3 or more chronic diseases. So we have to change the model that we have for care from the acute care disease model, the kind that you used to see on Marcus Welby, where someone would get sick and they'd come in and Marcus Welby, well, actually it was Consuelo that really ran the office, and the person would come in.
You're definitely showing your age,
Yeah,
Dave.
I know. And Marcus would ask a few pointed questions and come up with a diagnosis and write a prescription, and the patient was well. That's not the world that we live in now.
Yeah.
We are managing diseases rather than curing diseases, and we have to have a different model. You mentioned, what do we do with 13,000 employees? Steve's job, my job, Paul's job, all of our jobs right now are 2. The first thing is we got to take great care of the patients that we're committed to serve here in Eastern North Carolina, and then we want to make sure there's a job for every one of those 13,000 people because they're taking great care of the patients. But as Steve mentioned, as Paul has talked about, the model will need to change. And if you were running a car plant, you could shut down the line, stop the line, retool it, and start it up again. What we're doing right now is like changing the engines with the airplane in the air. We have to change that model while we're still taking care of the patients who are sick, but then make those investments in the patients who aren't sick. As I mentioned, 5% of people eat up 50% of the healthcare dollar. 53% of the people in the United States only eat 5% of the healthcare dollar.
Mm-hmm.
So what we have to do is we have to make sure that those 53% don't become the 5%. Then there may be enough money.
Let me get Dr. Cunningham in here. Dr. Cunningham, I want you to speak to this also, but funding for the medical school is a problem. You know, the university does not own a hospital, and there are models where universities own hospitals and have a medical school, and there are models that they don't. And of course, you have to depend on state funding. And frankly, the legislature has been a little tough on us the last few years, and we're working on some of that right now. But you have funding issues right now, and so talk about that a little bit with how it relates to the workforce and what's happening in the community.
Thanks for this. And, you know, the old saying is that if the argument is not about the money, it's about the money. And it really is. The fact of the matter, we as a medical school are just as unique as the other 140-odd medical schools in the nation. And so we struggle with our own specific, unique environment. We were designed not to have our own university hospital. That was in our original affiliation agreement. The legislature said that this was not something that we were allowed to do, and we abide by that today. And our funding model, therefore, was originally designed with that in mind. Over the years, our physicians contribute to 71% of our budget. So the state support, which was almost 100% 40 years ago of our medical school, has dwindled and shrunk to about 21% of our total medical school budget. As the ACA and other forces in the nation compress the economy of medicine, that is going to affect the ability of our doctors to continue to support the mission. And therefore, whatever gap opens up will need to be filled by some other mechanism. Since we were designed to really serve the state of North Carolina, and in fact, over the years, the return on the investment has been incredibly vast. We've really focused on this mission from day one. We think it's important for our legislators to remember that in making the calculus in supporting us as we move forward.
And let me point out that we have a legislator here, Representative Brian Brown, present company excluded. When I made my comment about the legislature being tough on us, the state is really wrestling with a lot of problems, and medical schools, you know, somehow got. Didn't fare too well in the last 2 sessions, but Brian Brown has been a champion of trying to fix some of that, and I think we're going to have him on at the 5 o'clock hour, and we'll get his commitment that he's going to take care of it this session. So let me go to Greg Murphy. The relationship that we have a unique relationship here, Dr. Murphy, a medical school and a world-class hospital right here together. And you and I have had this conversation before. They really complement each other, and I don't think either one would be what they were without the other.
I would agree entirely. That one would not exist, one would not be in the position of prominence without its historical, historical perspective. That's what makes this community different. And I personally, just with colleagues, friends, don't know of any other example of this in the country. We have a fine medical school. We have a fine practicing private practice community with excellent specialists. We have a wonderful supportive Vidant medical group, really more out in the region. One thing that's really come to the forefront is, you know, with everything that's going on, with Medicaid not expanding, with revenues decreasing, with more people being sicker, there's so many challenges that get placed upon us fully as a medical community. And one thing that's really come to the forefront is that if we in this community, and I say this with the three heads I'm talking about, our private community, our Vidant community, and our medical school, don't, and we do, if we don't see this as a common threat, then we will all perish. And those are true words, because perishing is happening in the United States in healthcare systems. And we're strong enough, we have the ability, we have the professionalism, the expertise to continue to be successful in this region, and not only be successful, but to thrive. But these are the challenges that we face now. We're, as Dr. Herman says, we're reinventing ourselves on the fly. And I see that not only on the private level, but on the full whole hospital level.
I'm going to take a quick break. We're going to get a commercial break in, and then we're going to come back, and I would invite anybody in the audience that has a comment or a question for this esteemed panel to come up and participate in the conversation when we return. Again, this is the kind of conversation that, you know, we don't have often enough with the community, and so I do hope that folks will come up and participate. And if you're listening on the radio, please come join us here at 400 St. Andrews. And thanks to our sponsors. Greenville Toyota was one of our underwriters today. Homer Tire Real Estate, Wilkerson Funeral Home stepped up. Don Wilkerson was with us earlier this morning. And the folks from Delcor have been the underwriters for this event, and we really appreciate it. I also have to say a very special word of thanks to the folks at Suddenlink, and Phil Oschlager and Bill Paramore. Ken Willard was out here this morning. I believe some of the Suddenlink folks are here now to make sure our technical stuff is running well. And as I mentioned at the beginning, Betsy Gray, our host today here at 400 St. Andrews, thank you to all of you. Let's get a quick break in. We'll take a little breather here with the panel, but when we come back, more discussion on health care in Greenville and Eastern North Carolina and what it means to our community and have a great health care system like we have and how to keep it strong. And again, we return. We hope we'll have some discussion with the audience. We'll be right back. Okay, welcome back. We are live here in the afternoon, our 3 o'clock session, health care in Eastern North Carolina with Dr. Dave Herman, Dr. Paul Cunningham, Dr. Greg Murphy, and Mr. Steve Lawler, the president of Vidant Medical Center. And now we're going to open the floor up here to the live audience here at 400 St. Andrews for questions about health care and how it relates to our community. We've got a gentleman at the microphone. Sir, give us your name.
My name is Willie Wilson, and I've been asking questions all day, so
Yeah.
it's not new. Your presentations and your comments today, from my perception, is at a very global or macro level. Now, when we talk briefly about the effect, when you talk briefly about the effects of the ACA of $400 million, I think implicit in that act also is a cost reduction, which you didn't get too much into that. So I think that somewhere the thinking is that there's going to be an offset between the reduced revenue and the cost reduction. The other thing is Dr. Cunningham, I think it was, talked about access. I see that in two units. One of them is availability, which I think is what we've been talking this morning, not so much access. The access component gets to the micro level, the individual. And how do you address those that can't afford the kind of insurance that would be required? Now, I've had experiences 3 times with the Vidant system, and it's a great system. I commend you guys on the care you give. But anecdotally, I had a call last night from someone that had to go through a serious surgery. and she had gotten a bill last night, and she couldn't believe it. For 1 day in the hospital, the bill was $91,000. Now, in looking at the bill, she couldn't tell whether that included the surgeons or not, along with the anesthesiologists and the other that support a surgery. The average person cannot afford insurance that would pay for that. I mean, you just can't do
Let's
it.
let them respond. Those are great
Okay.
points, and we haven't talked about affordability yet. And you bring that up, Mr. Wilson. I appreciate it. Let's let Steve Lawler address some of those questions.
I'll start by talking about the work that we're doing to be good partners for this community, as well as to be prepared as the Affordable Care Act continues to mature and roll out. I mentioned earlier that the cumulative effect of the Affordable Care Act would be receiving less dollars from the federal government to care for Medicaid and Medicare patients, and that is a reality that everyone is facing. At the micro level, the things that we're doing as an institution to ensure that we're prepared, and as Dr. Herman said, to ensure that we're providing the best care and the best experience for people who walk through that door, but also that we're protecting those people that that are part of our medical center family, the people that we rely on every day to provide that care. So we've actually been working pretty hard over the past 5 years, thinking forward in regards to how do we prepare our organization for these changes. So some of the areas that we've been focusing on are looking at how we staff. What's the right number of people that we need to provide care at the bedside? What's the right number of people that we need to be able to support those people that are caring for folks? And over the past several years, we've been very disciplined and focused in making sure that we're matching patient need and organizational need to workforce. So we're a little leaner now than we were a few years ago. And that's something that we continue to test and continue to understand. We're working hard to reduce variation in care. So what we're trying to do is to make sure that based on science, the patients are getting what they need when they need, and that we're doing everything possible for that patient when they need that care, but we're also not doing things that the patient doesn't need. And I can tell you in medicine, performing tests or procedures is something that we've really focused on in making sure that we're not doing those things that the patient might not need that we may have done in the past. So really focusing on delivering the right care at the right time at the right place. And then finally, we're really working with our physicians very closely on what we use and how we use it. Are we making sure that we're delivering, and I'll give an example of something as simple as Tylenol. The difference between an IV Tylenol and a tablet is remarkable. An IV Tylenol dose is $300. A Tylenol tablet is less than $1. So it's working with our physicians and our staff to really be very thoughtful in how we make decisions based on what patients get, and then doing it in a way that our patients are getting the best quality care and doing so in an affordable way. So today it is cheaper to get care in our hospital than it was 2 years ago.
And while we're allowing somebody else here on the panel to address some of these things, if anybody else has a question, please come to the microphone. Dr. Herman, the gentleman, Mr. Wilson, makes a good point about affordability. We live in fortunately here in Greenville, we have a thriving economy. If you go 10 miles in any direction, you've got abject poverty in a lot of areas in eastern North Carolina. And when people need medical care, how do they afford it?
Well, the reality is, Henry, that a lot of people can't afford it. Getting down to the micro level, healthcare is extremely expensive. We spend about $4.5 million a day at Vidant Health taking care of the patients that we care for. 34% of those patients can pay for the cost of their care, plus provide a little margin to take care of those who can't. So over 2/3 of our patients can't pay for the cost of their care. We had a conversation. We have community forums where we sit down with the great people who work at Vidant Medical Center and other places, and a nurse raised her hand and said, I don't think it's fair that some people pay more for the same service that other people do. And I said, we have a rule that if you ask me a question, you have to come down and stand next to me. It's kind of a penalty for asking a question, but people do it anyway. So she came down. I said, so what are you what's your job here? She said, I'm a nurse. I said, how many patients are you caring for today? She said, 3. I said, okay, let's suppose today that each one of your patients can pay for their care, so we're going to pay you your full salary. That'd be great? She said, that's great. I said, let's take tomorrow where you're taking care of 3 patients, but let's make it just like an average day at Vidant Medical Center, where only one of those patients can pay for the cost of their care. So I'm going to only pay you 1/3 tomorrow what I'm going to pay you today. And she said, well, that's not fair. So we spend a lot of time shifting money from one bucket to another, from the people who can pay for their care to the people who can't, which is really a hidden tax. When we talk about just the cost of health care, every month our electricity and phone bill is $2 million. We spend $6 million a month for just hip and knee implants. We spend $1.5 million a month just for blood. Of the $4.5 million we spend every day, $2.5 million of that is paying the salaries of our employees. So having great people deliver great care with all the great things that we can do is expensive. So that money comes in and comes out just as fast as it does. And that's the challenge that we have.
Dr. Cunningham, you got a comment?
I think the gentleman asked about access to care, and he wanted to understand more about the micro level. I want to say that access to care is somewhat stratified. We heard today that Vidant Medical Center is 90% occupied. I would like to surmise that 60% of those patients came from outside of Pitt County and were brought in. No questions were asked about whether they could pay or not. They were just brought in. Patients who show up at our emergency department at Vidant Medical Center, manned by Brody School of Medicine faculty, are never refused service. They cannot be refused service. That is a part of an obligation that's regulated. And therefore, we're both vulnerable and proud to be able to provide those services, and they have to be provided they have to be paid for in some meaningful way. There's another stratification that I think is important to most of us who are not immediately ill. You try and call your doctor and see when you can get an appointment to see them. That will give you an idea at the personal level of the efficiency of our system to see somebody with a routine issue or no issue at all, a well checkup. And for most physicians, there is at least a 2 or 3 week wait for you to get an appointment to be seen here in Eastern North Carolina. So that may be one of the defining factors that we'll have to resolve in the future.
We got somebody with another question, but Dr. Murphy, I want you to speak to that because you're a urologist. And getting an appointment with a urologist, I've got your cell phone, thank goodness.
Please don't let that out.
I'll be willing to sell that number. But getting an appointment with a urologist in Greenville, it takes a long time. You guys are so busy.
It does, and that's reflective of a nationwide trend of physician shortages. That, as far as urology goes, it's the #1 physician predicted shortage in the future moving as we get an older, aging population. But it's the truth. However, when people become sick enough, that's when they show up in our emergency department. I would like to talk about one thing. We talk a lot about our delivery of care, what it means for hospitals to deliver care, what it means for physicians to deliver care. And that's really what the ACA talks about. But I think really a greater national discussion that needs to occur is what goes back to personal responsibility. Who is really at fault or who is really in charge of their own health? Are we eating right? Horribly, no. Are we exercising? No. Are we seeking care in a timely manner? No. And so those types of issues I really believe need to come to as much forefront as the affordability of care is the responsibility of care, the responsibility of each individual to treat their body in the right way and to seek the appropriate care. We're spending so much money when things are not appropriate.
We've got like 6 minutes left. I've got another gentleman at the microphone here to give us your name and your question or comment.
Yes, my name is Don Cavallini, and I'm a former, well, I guess retired healthcare provider. And in addition to being, a tax-paying homeowner here in Greenville for almost 30 years. And I really appreciate you all coming because more accountability, the more we know, the better we can be informed and be better voters and participants in this, in our society, in this community. I'm listening really carefully, and you know, Dr. Murphy, you said with all the challenges, and you included the failure to get Medicaid expansion here in North Carolina, that we're going to be hard pressed. And I heard Dr. Herman talk about reinventing on the fly, no less, and going from an acute care model to a chronic disease model. Well, how much has the governor's refusal to accept the federal money for Medicaid expansion, how much will it cost Vidant Health?
That's a good question. We talked about that. I was hoping we'd have a chance to get to that. And the question about whether to expand Medicaid or not, there's no doubt, Dr. Herman, that it's costing your facilities, your 9 hospitals, a lot of money, particularly in eastern North Carolina. But we've just also heard you and Dr. Cunningham say that no one's being turned away for services. So it's really a matter of who takes the hit, right?
That's right. The design, the way healthcare was designed, or healthcare financing rather, was designed before the ACA, was that hospitals were given what they were called disproportionate share payments. If your hospital saw more people that can't pay than the average hospital across the United States, those payments went to the hospitals. The amount of those payments to the hospitals in North Carolina over a 10-year period are almost $6 billion. In the Affordable Care Act, what those dollars were swept back to Washington, and those were supposed to be redistributed through Medicaid expansion. So what we're seeing here in North Carolina is the withdrawal of that $6 billion over 10 years to go to other states, and that's our taxpayers' money, but that's not coming back to the state through Medicaid expansion. So when we look at the dollars, for us, it's about $70 million every year for Vidant Health. Let's put that in context. Last year, Vidant Health gave $152 million of uncompensated or undercompensated care across our system. That, having that $70 million goes away is a tremendous hit. But the patients don't go away. And as Paul said, we will never turn them away, and we can't turn them away. These are our friends. These are our neighbors. This is the community that we've decided and made the pledge to serve. So the money went away, but the care stayed.
You know, and we could argue the politics about Medicaid forever. You know, somebody's got to pay. It's going to cost us somehow in higher taxes, or it's going to cost us maybe in the way that you are able to deliver care and those kind of things. But it's going to cost somebody somehow.
That's right, and I think the unfair part of it, Henry, is it's shifted to oftentimes to the people who can least afford to pay for it.
Yeah.
So really, if you're a small business owner and you have a commercial product, Blue Cross Blue Shield or someone else, and taking care of your employees through that, your rates are higher because some of that money has to go to pay for people who can't afford their care.
We've got 2.5 minutes left. Who has a compelling thought that they want to finish with?
I'll just I guess piggyback on Dr. Herman's comments. You know, I do think it's important that North Carolina take a hard look at Medicaid expansion. I think it's the right thing to do, not only for the state, both from an economic perspective, but it's the right thing to do ethically for those people that need care. We do support the governor, though, in his approach to overhaul the current Medicaid system, and we are very supportive of his latest direction in regards to, you know, relying on the provider community, physicians and hospitals to craft a solution, you know, rather than relying on an organization from outside North Carolina to do that. So I'm glad Brian Brown is here. We appreciate his support in those efforts, but you know, as I said before, from a policy perspective, it's important that we ask the people that are responsible for delivering the care to help design it and run it.
And I want to finish, give Dr. Cunningham a chance, but I will say this, at the risk of sounding like I'm defending the governor, which I'm not. The governor's never said he won't expand, that North Carolina will not expand Medicaid. They're trying to get their arms around the problems first. And again, without getting to the political side of that, I don't think anybody can argue that they're not major problems that have to be handled. Dr. Cunningham?
So whilst all these complexities are swirling, it is still the obligation of our medical school, our research enterprise, our educational enterprise to be as creative and imaginative as we can be to create the right model for the future. So we're hard at work in doing that with our partners.
Greg Murphy, you have a 30-second closer.
I think just in closing, as I said earlier, this community is a wonderful, vibrant, smart, well-oiled institution, well-oiled group. And we, as a group, work together. We see the commonality of our challenges, and we see what needs to be done in the future, and I believe all of us are working well to try to have a successful future.
With you folks running the show, I think it's easy to see why we have a world-class health system here, and Brody School of Medicine, extremely well run. And I just want to thank you for all that you do and for what you mean to our community. Let's give these gentlemen a hand. Thank you very much. And again, this will air on Cable 7 several times, and also be available on GreenvilleHeadlines.com, the entire video panel, if you'd like to watch it again. All right, a quick commercial break and the top of the hour news, and we're back with our panel on the economy.